Radhika. Good afternoon, everyone. On behalf of Rubiol Clinic, I would like to thank CAHO for giving us this opportunity to partner and organize the CQE on medication safety. We welcome all the faculty members and delegates for this learning session on the theme medication safety, medication without harm. So before we go on for the sessions of the day, I would like to briefly introduce the theme for today, followed by the introduction of our organizing team. As we all know, medications are the most widely used interventions in healthcare, and every person around the world will at some point in time in their life take medications to prevent or treat an illness. However, medications can cause serious harm if incorrectly stored, prescribed, dispensed, administered, or if monitored insufficiently. And unsafe medication practices and medication errors are a leading cause of avoidable and preventable harm in healthcare across the world. So acknowledging the substantial burden and recognizing the complexity of medication-related harm prevention, the theme for World Patient Safety Day this year is medication safety, with the slogan, medication without harm. We all are well aware that medication errors occur when there are weak medication systems, and human factors such as fatigue, staff shortage affect all the steps of medication management like prescribing, transcribing, dispensing, administration, and which can then result in severe patient harm, disability, and even death. So we as healthcare professionals need to prioritize medication safety and address unsafe practices and system weaknesses with a special focus on three main causes of avoidable harm, which can arise from high-risk situations, when there are transitions of care, when there is polypharmacy, that is concurrent use of multiple medications, and most importantly, medication errors, which arise due to confusion of drug names, poor communication, like LASA drugs, or even misunderstanding of medical abbreviations. And four specific objectives have been defined by WHO for this theme on medication safety. The first being to raise the global awareness of the high burden of medication-related harm due to medication errors and unsafe practices, and to advocate and implement urgent action to improve medication safety. Second is to engage key stakeholders and partners like all of us today in the efforts to prevent medication errors and reduce medication-related harm. The third is to empower patients and families and to actively involve them in the use of safe use of medication. And the fourth is to scale up the implementation of this WHO Global Patient Safety Challenge, that is medication without harm. So all the sessions that we will be attending today are based on the different aspects of this theme on medication safety. We hope that it will be a fruitful learning session for all of us, which we could implement in our daily clinical practice. So before we move on, I'd like to also briefly introduce our organizing team from Rubiol Clinic. Our organizing chairman is Dr. Kapil Zirpe, who is a senior intensivist and director of our neurocritical care unit at Rubiol Clinic, Sassoon Road, Pune. Our organizing secretaries are myself. I'm the Deputy Medical Director at Rubiol Clinic, Sassoon Road, Pune. Dr. Sonia Bhagat, who heads our quality team at Rubiol Clinic Group of Hospitals, Pune. And Mr. Shaji John, our General Manager of Pharmacy, Stores and Purchase for Rubiol Clinic Group of Hospitals, Pune. And to take this program forward, I'd like to introduce our MC for the day, Dr. Radhika Zare, our Manager, Quality Assurance Department from Rubiol Clinic. She has completed her bachelor's in physiotherapy, followed by an MBA in hospital administration. She's an experienced healthcare professional in hospital administration and quality. Welcome, Dr. Radhika, and over